Good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor for the University of Kansas Medical Center. Welcome back to Open Mics. You know, a stroke, we think about it as being an old person, maybe my age, but it can happen at any age, which is news to a lot of people who think of strokes happening mainly to older adults, which is true. They mostly do. But it is also true that children and young adults can suffer a stroke. Our patient joining us today, joining us virtually, is only 25 years old. She suffered her stroke 9 months ago. Please meet Amanda. Okay, Amanda, you're going to have to help me with this just a little bit. Is it fiddle-dee?
Fiddle-die, but that's okay.
Fiddle-die, fiddle-dee. I gotcha. I think I could do that. All right, Amanda Fiddle-die. We will hear more about her stroke story in just a minute. And thank you for making sure I could actually maybe say it. Hopefully I won't mess it up too many times. Amanda was transferred to the University of Kansas Health System to treat her stroke and eventually came under the care of Dr. Tiffany Barkley. Now that one I can do. The Barkley, that's pretty standing. Yep. Hey there. Dr. Barkley is a pediatric neurologist who founded a first in the region stroke clinic for patients and young adult patients up to the age of 45. Also joining us is Robin Field, an ambulatory clinic registered nurse and the care coordinator for this unique stroke clinic serving the young. Before we say hello to Amanda, let me share her remarkable story. Just 9 months ago, Amanda was an active and healthy 25-year-old college student studying veterinary medicine at K-State. As she drifted off to sleep one warm July evening, she noticed numbness in her arm, which she attributed to sleeping on the wrong side. But by 3 a.m., Amanda awoke to intense pain. She suffered a spasm so strong it knocked her out of bed and into a severe arched position. The medical term is, okay, Dr. Barkley, you're going to have to help me with this, episiotomus.
That you could use that term, certainly. It could just be, you could cause it tonic spasm too.
Yeah, but did I say it right? Is it episiotomus? Episiotomus?
Yeah, that's right. Yep. Mm-hmm.
I said it 3 different ways, so hopefully one of them's right. Okay, the violent pain and spasm woke her up and woke up her boyfriend, who tried to talk with Amanda, but Amanda could not speak. She was taken to the nearest hospital and from there was transferred to the University of Kansas Health System. Here, doctors determined Amanda was having what's called an ischemic stroke caused by a clot, type of a stroke where you're not getting blood into part of your brain. It is the most common type of stroke to have. Amanda, I hear you've come a long way since that night in July. I understand you have some mild aphasia lingering from the stroke, which means you have sometimes some difficulty finding words or with speech. Tell us how you're doing and how your speech is progressing.
Okay, so I couldn't speak at all for almost a week after I had the stroke. It was very scary because I thought of everything that I wanted to say, but the words weren't coming out. And the doctors, every stroke is different, and the doctors weren't sure if I would ever speak again. I have been going to speech therapy since the stroke up until December, and by that point, in the month of December, I felt like the speech therapy wasn't benefiting me anymore, and by that time, I had started school again, and school has really helped me with my speech, and now I'm talking like this, so that's great.
You're doing very well, so congratulations on what, I know that's a lot of work going into a stroke recovery, and that's really remarkable. What do you think has been the hardest thing, the most challenging thing for you to recover or to do after your stroke?
That's a great question. One of the things that I'm really struggling with the most is like fine motor skills in my dominant hand. I'm still struggling with writing, typing, using my surgical instruments. But I have been going to occupational therapy as well, and I'm still continuing to do that twice a week.
Great. Are you seeing changes, or how's it doing? Is it getting better, or staying the same?
So at first I was noticing like very rapid progression. I was able to like squeeze my hand after I fell asleep, and move my arm again, and everything else. But now, since I've come so far, the changes are less noticeable, but my occupational therapist does progress reports, and my grip strength has been improving, my pinch strength has been improving, and I can feel things again in my dominant hand. So
That's great. Well, congratulations, and hopefully you'll continue to see recovery. Dr. Barkley,
thank you.
You betcha. Dr. Barkley, Amanda had an ischemic stroke, which we've established is a more common type of stroke, but how does she benefit from a stroke clinic dedicated to young people like her? And we'll talk about why she even had a stroke at this young age in just a moment. But
Yeah.
how about that stroke clinic? Talk to us a little bit about that.
Yeah, so, my background, like you mentioned before, my initial training was in pediatric neurology, and then I went on to do a fellowship in vascular. And so, stroke, especially in young people, is vastly different than stroke in older people. There's a lot of underlying both genetic predispositions to have stroke, but also there's underlying conditions that older people are not as at risk for when they have stroke. And unfortunately, stroke in the young over the past decade or so has been increasing significantly. We've seen probably about a 50% increase over the past decade. And so it's really beneficial to have a clinic dedicated to understanding the pathophysiology and the prognosis for stroke patients and they're young. And so they're more likely to suffer long-term consequences related to the stroke. And that's including, loss of job, more isolation, more depression. And so it's really helpful to have someone and a team who's dedicated to that particular patient population.
Well, and I think team is the operative word there. And because you see patients like this frequently, that's got to be really helpful and help patients feel a part of a larger community.
Mm-hmm. Yes. And we do have, at KU, we do have, a stroke survivors group, especially for stroke in the young, which is very immensely helpful because it can be very isolating. Most young patients never even really think about stroke or even heard of a stroke at this age. And so it's really important for patients to have a good support network, especially during the recovery of a stroke.
Yeah. Now, these specialized clinics only happen at an academic teaching hospital. Talk to us a little bit about why that's the case.
Yeah, so it takes a lot of resources to build a multidisciplinary clinic and a lot of training. And so every person who's involved, from the nurses and schedule coordinators to, the doctors in the clinic, the occupational physical therapists, and our subspecialty team. We actually have a multidisciplinary team with cardiology, genetics, and hematology. And so it takes a very dedicated team to do that. And usually that can only happen in an academic center due to resources.
Yeah, it's a big deal because these patients are always complicated, and stroke in a young person, as you mentioned, is so different. We're going to talk more about that in a moment. Now, Robin, as a nurse and care coordinator for the clinic, what's your unique perspective with these younger stroke patients?
Well, my job as a clinical care coordinator in this particular clinic is to help them navigate their recovery, to help them understand their medications. We can get a lot more compliance that way if they know how to take them and why they're taking them, to answer their questions, to provide support for them, to make sure that Dr. Barkley is apprised of what their needs and concerns are, to empower them. They're worried that this is something that could possibly happen, again to them. They're interested in steps that they can take for prevention. So I spend a lot of time on the phone talking to our patients and helping them monitor their lipids, hypertension, follow up on referrals to various disciplines as needed.
That's got to be a really important part. I mean, I do cystic fibrosis, and there's this thing that you get all these younger people in, and navigating the American healthcare system and getting to different appointments and getting them more coordinated and getting insurance coordinated is not just a hard job; it's a battle. I bet you spend a lot of time trying to help get that care coordination complete.
Well, we do, and it's important to not just make the referral, but to follow up on that referral, and make sure they did get scheduled. To monitor their physical therapy, their speech therapy, their occupational therapy.
It's a big deal.
All the prior authorizations on medications. And then, of course, if, to do a little bit of, hand-holding in a sense, in that this has been a big loss for them. They're young, they have their whole lives ahead of them, they may be on the dating scene, they may be starting out with, young families. They don't know how this is going to affect them going forward. There's major financial concerns that they have. I work with some of the employers, writing letters and things to try and get them to make accommodations in the workplace to get them back to work. And then ultimately, if that doesn't happen, then we walk them through the disability process.
Yeah. I think it would be difficult, and no matter what the age, but if you're younger, it's got to affect the mental health challenges facing a stroke patient at a younger age. Dr. Barkley, you go first, then Robin. Talk to us about some of those mental health challenges, and obviously we need to hear from Amanda after that.
Yeah, unfortunately, stroke in the young, the majority of patients have significant trauma from the event and significant mental health challenges, not only just from the stroke itself, but from everything that they've gone through. About 2/3 of patients will go through depression and PTSD and isolation. And so that's something that we always have to keep in mind and help the patient navigate through and give them resources, whether that be, medication help, survivorship resources to get them connected with other survivors who have been through similar things, and to get them, psychiatric care as well. And it can be very challenging, as you know, especially with psychiatry, because it's so much needed in the healthcare system.
Yeah, that makes sense. Amanda, how have you stayed positive and soldiered on through this?
That's a great question. So I just keep in mind that I didn't ask for this to happen to me, and it's not my fault. I celebrate the wins, no matter how small. I passed my boards exam only 5 months after my stroke, so...
All right, congratulations!
Thank you. But I have a huge support system. Specifically my boyfriend, his name is Grant. He literally saved my life, and I can't thank him enough for that. He slept on the couch in the hospital for a month straight. And I'm getting emotional. But my parents even offered him a hotel room to like get a good night rest, and he refused because he said that he wouldn't sleep being away from me because he would be worried about me. Additionally, I have really close friends in vet school. Specifically, their names are Danielle, Hannah, and Aiden. And on the night of my stroke, Aiden and Hannah were both away in their respective home states, and only Danielle was here. So I called her at 5 a.m. and asked her if she could take care of my cats because I had a stroke and I don't know when I would be back. And she said yes, and she took care of my cats every day, twice a day for a month straight. Eventually, when Hannah and Aiden came back, they took turns like taking care of the cats. I have the school has been super supportive of me as well. The bioengineer here 3D printed custom rubber inserts for my instrument handles. So that was very accommodating. And additionally, the school just let me come back when I was ready and recovered.
You know, okay, you're gonna make me cry, Amanda. That's a great story. Not that you had to have a stroke, but about the support. And you can imagine how hard it is when patients don't have that kind of support system. What a great support system. And you tell Grant thank you, and you know, K-State's a great place, obviously, and the vet school is a special place. So congratulations. And I have a cat. I love my cat, so I'm glad your cat got taken care of as well. And I love seeing the picture in the canoes. What river were you on in the picture?
I was on actually Tuttle Creek.
Right.
It's a man-made lake here.
Yeah, you bet. Yeah, that's the best. All right, now there are many conditions that can cause a stroke in younger people. Amanda, in your case, it was discovered that you had have a very rare vascular condition called fibromuscular dysplasia, or FMD. This is a condition causing abnormal cell growth in the walls of our arteries, leading to narrowing, bulging, or tearing of the artery. Often, the arteries that go to the brain. And that's Amanda's story. Amanda, FMD happens 90% of the time in women around your age. Has anyone else in your family been diagnosed with this?
They have not. When I tell you it came out of nowhere, it literally came out of nowhere. Yeah.
Now, we know that FMD can be managed. How is the stroke clinic helping you navigate that, both your diagnosis and treatment?
I visit with Dr. Barkley every, I want to say 3 to 6 months. And she has offered a ton of support, answering questions, and customizing my medication schedule to fit me.
Oh, that's remarkable. Now, Dr. Barkley, Amanda, with all this, needed a clot removed when she arrived, so it took the whole neurointerventional team. We have some pictures of that clot and her FMD. Can you kind of walk us through that and tell us how that clot resulted in these symptoms?
Yeah, so the picture you're looking at here is a picture of her MRI, and everything's kind of flipped. So the right side of the picture is the left side of her brain, and you can see some areas on that left side that look a little bit brighter when you compare it to the right side, both, deep in the brain at the level of what we call the basal ganglia area, but then also higher, which is the images on the right. And that is areas of stroke. And that you can see that on this particular sequence of MRI. These are still shots from the angiogram from the thrombectomy that she went under. And you can see initially when they, on the left picture here, when they went up, you can see kind of at the bottom of the picture, there's some abnormal beating there. That's a classic sign due to the dysplasia, their abnormal growth in the vessels of FMD. And you can see higher up, there should be blood flow to that entire left hemisphere, and we don't see any. And that's where the clot was. And you can see that also on the right image here, which is just a different view. It's looking at it instead of front on from the side.
Yeah, it's pretty striking when you see that just the blood just stops flowing. So, and it does look like, as you said, that string of pearls, a clue for FMD. What's the risk for Amanda going forward around another possibility of a stroke?
You know, patients with FMD, because of the nature of the disorder, are going to be at higher risk to have stroke. And it depends. Some patients, you know, it's not a progressive course, and for some patients, FMD can be progressive. And so what we do is we usually monitor with imaging initially in the initial period. You know, it can be anywhere from 3 months to a year to follow. In her case, she had a dissection, which is a tear in the vessel. And then afterwards, we kind of monitor clinically, and then we do kind of follow-up imaging depending on how she's doing.
All right, well, young or old, we know that time is brain applies to all stroke patients. Is there an advantage for younger patients who get an intervention more timely, more brain plasticity or ability to try to adapt?
Yeah, so of course, you know, a stroke is time is brain. So every minute counts. Every minute that the brain does not receive blood flow, you lose about 4 million brain cells in that time. And so the faster, the better. And so patients, you look at long-term outcomes, patients who get quick interventions, whether that be through thrombolytics, so IV medications to treat clots, or through thrombectomy, which is the surgical intervention, they do better long-term.
Awesome. All right. Well, yeah, you know, I've always figured that the younger you are, the better you are when it comes to trying to adapt to these kind of challenges. And again, whether it's a neurological challenge, a pulmonary challenge, what have you, younger patients tend to have a little bit better ability to adapt. All right, we're here to answer your questions. Send them using the links on your screen, YouTube, Facebook, or email the Medical News Network. Well, okay, there he is. I didn't get it out yet, but I got to see the flapping wings. I love the flapping wings, Hawkeye.
Yeah, no, our production team did awesome in making that for sure.
They did. All right. Well, Doc Hawk, vaccines are back in the news this time for service members. And I'm going to hit one other topic today. Sorry to pull you all, but it just popped. The federal government no longer is requiring the flu vaccine for men and women in the military. From your perspective, how important are mandatory vaccinations?
Very important. You know, I think the simple answer is we've seen this before, right? Over 100 years ago with the influenza outbreak of 1918. Now, we're not in that same situation, but I think we can draw a lot of parallels, right? You have a lot of young people who are otherwise healthy, but they are living in close quarters. We know that influenza vaccine helps reduce even infection, but also morbidity and mortality. So I think it is very concerning. I think the mandate in this case for influenza vaccine was certainly very important. And just as an aside for some update and most recent data, even for this past season when the influenza vaccine wasn't a good match, we have some initial data from the CDC in adults 18 and over showing that if you did get influenza vaccine, you were actually 33% had a 33% reduced risk of infection, which is a good thing. We don't normally expect vaccines to really protect against infection itself, but protect against the complications of disease. But you did have a reduced risk of infection. And more importantly, those adults 18 to 64 had a reduced risk of going to outpatient visits for infection and illness, and a 34%, 20 to 34% risk reduction in going to the hospital. Now, again, these are generally or typically healthy adults, and so it's not all about going to the hospital or death in this case, but it is significantly important when you have people who are ill, if they can't perform their duties, lost work, especially if they're out on the front lines, they need to be tip-top all the time. I think this could open up for a lot of problems in not having this mandate, but hopefully these young people will see and understand that and get the vaccine, especially, you know, when you're in basic training in those close quarters, or especially on those ships where really there's nowhere else to go and those infections can spread so easily.
Yeah, I'm surprised about that, especially in close quartered areas, that the military would put young people at risk on the basis of bad science. And so anyway, let's talk a little bit about vaccine efficacy. It's not a perfect match every year, but you still get coverage even when it's not perfect. It can reduce the risk of hospitalization and death, which has been the threshold we're trying to achieve.
Absolutely. And, you know, like I said, even this past year, it was a bad match. You had a little bit lower than we would like and expect as far as visits to emergency departments or clinics, and also with lower hospitalization risk than we would like, but it still did provide that reduced risk of going to clinics, going to the hospital, even in this season when that vaccine was not a good match. So I think overall, what we have also seen throughout time is that even just getting the influenza vaccine does help reduce your risk overall of developing serious complications during that respiratory viral season.
Yeah, it's really important. Now, touch on the safety of vaccinations, because this always comes up when we have something where they're trying to back off a mandatory vaccine.
Yeah.
And the problem is that, in my mind at least, Hawk, there's the risk of the vaccine, and then there's the risk of not being vaccinated. I think you and I both know where the bigger risk is.
Yeah, you know, certainly this is what it was so important about our processes here in the United States and really globally, but the U.S. was just a great leader in that with the FDA and the CDC in all of these organizations and mechanisms to, number one, even in the initial stages of looking at the vaccine, looking at the safety. We know that all these vaccines that are on the market right now, but especially since we're talking about influenza, but especially the influenza vaccine, certainly there is a risk of side effects or adverse events. There is that with any medication or any intervention that you get when you seek medical assistance. But what we know through not only the initial testing of these vaccines, but also through years and years of combined data, looking at people who have been vaccinated, looking at side effects. There have been no safety signals with these vaccines. So again, particularly for influenza, extremely safe vaccine. And again, just like you said, getting the disease is much worse than getting the vaccine. Number one, because the disease will always provide more complications, more risk of illness. Certainly, again, we know that there are side effects and risks associated with vaccines, with any drug or medication, but we also have those active systems to continue to monitor safety. And right now we have very safe and effective vaccines to help reduce the risk for everybody for complications and hospitalizations. But again, more importantly, and we've talked about this before, when, you know, it's not only about that and going to the hospital, but it's about missing days of work or missing production or having to stay home with your children if they are ill. And all of these things affect families, children, parents on a daily basis, but we know the vaccines can help reduce those burdens.
Yeah, I think that's right. And I was reading this morning, there's a paper being presented, upcoming meeting, I think it came out of University of San Diego or UCSD, that looked at using the messenger RNA for pancreatic cancer and showed remarkable results. Some of the first actual really improvements in survival. Very small number of patients. But again, mRNA technology, A, is safe, B, can save your life, and 3, is being used now even to look at cancer. You know, science is cool, man.
It is extremely cool. And you know what? When the right systems and mechanisms are in place, again, we look at safety. You know, one of the tenets of you and I and all of our colleagues is first do no harm. And so that is extremely important. So that is one of the major things we look for. And then look at that efficacy. And I think what we have seen so far with the mRNA technology and efficacy and safety, it is extremely high. And I think if we can continue to work on that science, and especially if we have now things against cancer, like you say. So I think the horizons are bright, but we need to continue to have that research. And of course, what will always continue is that evaluation of safety.
All right, thank you, sir. Dr. Barkley, we established Amanda's stroke was caused by FMD. We also know that in younger patients, a hereditary condition called, wait for it, moya moya, can lead to a stroke. We have some images from another patient we treated back in 2023 who had surgery for her moya moya, which is Japanese for puff of smoke, which is what this looks like. The arteries in the brain narrow and other vessels grow to create this appearance and a stroke threat. What other conditions can typically lead to stroke in young patients?
Yeah, there can be several conditions. Actually, most of the time for patients with stroke, we call it what's called cryptogenic, meaning that we never find a direct cause. But looking at data now, there is definitely some underlying genetic polymorphisms that increase risk for stroke in young patients. And so other conditions besides, like moya moya, FMD, dissection, especially spontaneous dissection, is a very common cause for stroke in young patients. Sickle cell disease is another common cause of stroke. And underlying hypercoagulable disorders, for example, for like antiphospholipid antibody syndrome, can cause stroke. And a common cardiac condition, which is actually a normal variant, called a PFO, is more common in young patients who've had stroke. And so understanding those conditions is very important.
All right, well, thank you. We offer a free stroke assessment you can take online. Head to our main health system webpage and search for stroke. Dr. Barkley, it's important for young people and all sorts of folks to have this knowledge. Talk to us about the why.
Yeah, so, stroke can strike at any age. No one's excluded from stroke, from infancy to, late adulthood. And so it's very important to know because stroke is one of those things that time matters. And so the faster you're treated, the better outcomes. And so it's important to recognize the signs of a stroke, especially in young patients, because a lot of times they get dismissed as, other causes, for example, migraine, anxiety, and things like that. And so it's important to recognize those.
All right. Well, thank you. Alexis is in studio being collecting questions. Alexis, what have we heard so far?
We have a great question from Jeremy Yenser. Jeremy writes, is this like a stroke an older person can get and it's just happening earlier, or are there differences when it happens in a younger person?
Amanda. Amanda. Well, you can answer that, but I was going to go to Dr. Barkley too. Sorry about that.
That's okay. I'll let Dr. Barkley answer that.
Yeah, so, particularly for FMD disproportionately affects younger patients, especially younger women. 90% of cases who have stroke from FMD are young women like Amanda. And so the etiology, which means the cause of the stroke, is much different from the elderly population. And so to understand the pathophysiology and the treatment of those disorders that affect young patients is really important because the treatment outcomes, the prognosis and follow-up is much different.
All right, thank you. This has been a great discussion, and I'm grateful to all of our guests for being here. Would love to hear some final thoughts before we go. Dr. Barkley, we'll start with you.
So my final thought is that, stroke can happen at any age. No one's excluded from it. And so it's important to bring awareness to stroke in young patients. It's like Amanda's case. And we're very thankful that Amanda was willing to share her story to help bring awareness and education for stroke in young patients because the outcomes really matter. And the faster we are to be able to intervene, the better the outcomes.
Thank you, and thanks for being a part of the program, for the great work you do. Robin?
I'm not sure.
Final thought. Any final thoughts you have about today's program? Or about our patient?
Or about our patients. Our patients are wonderful, as you know. I think Dr. Barkley did a really good job of summarizing that up. I don't have a lot to add there, but.
Well, I work with a great nurse in the care of the CF patients, and I could not do it without her and all the work she does with care coordination. So I'm going to say a special thank you to you, because care coordination is hard, and navigating for patients is a big darn deal. But patients don't realize how much you all do in the background that they may never see.
Well, thank you. You're right.
Really
There's a lot of background
There's
work
a lot of stuff going out there
is.
behind the scenes. Of, oh, Dr. Stage, you did a great job. Reality is that, Joyce does a ton of that work.
Robin, you can edit that out.
All right. Amanda.
Thank you for giving me an opportunity to share my story. I really appreciate everyone who has touched my life after my stroke. Specifically, I was transferred into an inpatient rehab facility connected to KU Med. Those people, my speech therapist, my occupational therapist, my physical therapist, were all amazing. The nurses who took care of me in the ICU, the CNAs, the doctors, everyone was just so great, and I'm very thankful to be here.
Well, we are thankful you were with us today, and thankful that you're back in school at K-State. You've got your scrubs on. I did note you have a little purple thing going on there, and that's a beautiful thing. So congratulations, and keep up the great work. Let's check in with Alexis Del Cid one more time with a look at all things heart. Alexis?
Dr. Stites, we have such a good show tomorrow. Hospice was something that Terrence Bruce's sister refused to believe was their only option for her brother. How they went from end-of-life conversations at another hospital to a second chance at life here with a new heart. That's tomorrow at 8 a.m. Back to you.
All right, thank you all. And thanks to everybody for watching or being a part of our program today. I talk a lot about faith, hope, and science, and I tell you, you heard it in spades today. Faith comes from many places, and then sometimes it can come from your family, your friends, your partner. Hope, because you want and believe that you can get better, and you work hard to achieve that. And the science, the help makes it all possible. From pancreatic cancer all the way to stroke and all the way to influenza and other things. Science is there. Thanks for being with us today. We'll see you soon.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.